panic attacks every day. Um, Not every day, like every few weeks, I'm having some sort of panic attack. Um, I've had panic attacks when I was a child. Not a child, a youth. When I was a teenager. Was my first time I was having a panic attack. So the panic attacks, they started after taking psychiatric medications. The cause of it was psychiatric medications. That's why I don't advise anyone to take any sort of psychiatric medications. I don't advise anybody to take any psychiatric medications, because one of the side effects of psychiatric medications is the cause of panic attacks. So I think I was 18 at that time when I first started having them. Between 16 to 18, no, not 16, 18 to 20 years old, 18 to 20, maybe, around that time. And then for almost, it lasted about 1 year to 2 years before I got better. Like, I had to stop the psychiatric medications. After 2 years, I recovered from the panic attacks. So my sleep was improved, everything. And because one of the also issues with the panic attacks, you also have sleep problems, right? So anxiety causes sleep problems. So after stopping the psychiatric medications, it took me about 2 years, 1 to 2 years, before I recovered. I wasn't recovered completely, but yeah, like I got back to normal at least within 2 years. For some people, it could take them longer also. I heard some people 10 years. It's like a life. It takes almost a big chunk of your life dealing with anxiety. So that's why it's very important to learn about panic attacks. And that's why it's very important to learn about panic attacks. Now, I do believe it has some genetic predisposition. There is some genetic predisposition to panic attacks. My dad had it. I remember when I was a child, when I walked with my dad, I would see him shaking. At that time, I didn't know it was called panic attack, but I would see him have situations where his hand is shaking and he's having difficulty breathing, and then he will try to rush and to get things like quickly done. He'll be like, let me go to the hospital, let me go to the doctor. So he's rushing the driver even to get him to the doctor or to the hospital faster, because he cannot take it. So even one of my siblings, they had panic attack, I believe. So it runs in the family, kind of. But for me, it started right after taking psychiatric medications. I never had it prior to taking psychiatric medications. And so for almost 10 years, from age of 20 to 30 something plus. No, more than 20, 10 years. For almost 20 years. I haven't had panic attack for almost 20 years, right? After I stopped the psychiatric medications, 20 years, no panic attack. It started again after restarting the psychiatric medications. So I take psychiatric medications to help me sleep. I don't know, I developed insomnia for some reason because I was taking supplements and all that stuff. Something messed up with my hormones, probably. I don't know what it was. It's not anxiety. I didn't have any anxiety or depression. I took some herbal supplements and it messed up with my hormones, and I started having sleep problems. And the only solution was, according to the doctors, that I should take psychiatric medications to help me sleep. But because it's been 20 years, I never thought I'm gonna have panic attack from them. I didn't create that connection that, okay, maybe I'm gonna have panic attack. No, I didn't think of it that it was the cause of the panic attack. But after I started the psychiatric medications again, and panic attack returned. Now it's been almost more than a year or so. I'm having panic attacks, but of course they are less. I stopped the psychiatric medications again. I did stop them. They are less frequent than before when I was taking the psychiatric medications, but I'm still getting them once in a while. Like when I was taking psychiatric medications, I was getting panic attack almost every single day. Now I get them maybe every 1 month, every 2 weeks, every 3 weeks. Last night I had it. I had panic attack. 2 weeks ago also I had a panic attack. So it's almost maybe every 2 weeks I'm having panic attack. And the reason why I was having panic attack is because I can't sleep. When I can't sleep, for some reason, it causes panic attack. The lack of sleep is causing it. But because it also started because of the psychiatric medication. So once it starts, there are certain things, like once the panic attack starts, it's very hard to stop, right? It's like a continuous, right? It becomes continuous because when you start having panic attack, your body becomes sensitive to things, right? That's what anxiety is. Your body becomes oversensitive to a lot of things. Maybe the temperature in the room could trigger the panic attack, right? Caffeine could trigger it. Overeating can trigger it. Not sleeping can trigger it, right? So it becomes sensitive. Before taking the psychiatric medication, I didn't have panic attack. Even I had some sleep problems, right? So sleep problem didn't trigger it. Why? Because it didn't start, right? It didn't start because once it starts, then small things will start to trigger it again, right? Yeah, because you want to prevent the panic attack. Is you have to make it like, don't take psychiatric medications. That's the first step, right? Because once you take the psychiatric medications, it's gonna start the panic attack. Once that starts, then it's gonna take a long time to stop. It may take 1 year, 2 years, even 3 years. I don't know. It depends. It depends on the person. For me, the last time when I was younger, my body was more stronger, of course, and it lasted 2 years. Now I'm older. It's probably gonna last more than 2 years before I completely get rid of the panic attacks. So yes, like small things, like not being able to sleep can trigger it. If I drink caffeine, it might trigger it. If I go to the gym, it might trigger it. That's why I don't go to the gym anymore. Like small little things will trigger the panic attack. Insignificant things, right? Being thirsty sometimes can trigger the panic attack. because your body becomes oversensitive. Like it cannot tolerate uh, small things, right? It cannot handle small things, small stressors, right? The small stressors, it cannot handle them. So that's why it goes into panic attack. But once the panic attacks stop for a long period, then your body is able to handle small stressors, and then you will not get them again. So I advise anybody, do not take any psychiatric medications. Do not take it. Do not. Some people die from them. Some people develop brain damage from them. There's every side effect to them. They cause almost every single side effect you could imagine. Any disease you could think about, it could be caused by the psychiatric medications. From cancer to liver problems to kidney problems to heart problems, it causes almost every illness out there. So why even risk taking them, right? Don't take them. Don't take any psychiatric medications. If you want to die, go ahead and take them. If you want to live, don't take them. If you want to be healthy, don't take them. I made a mistake, the second time in my life I made the same mistake, taking psychiatric medications. And sometimes it's not because it's not really because out of desperation. It's not because I wanted to take them. No, it's because out of desperation, right? Because I'm thinking, what else can I do about my sleep problem? What else can I do? Doctors don't offer you any other solution other than psychiatric medications. They don't give you any way out. So you're desperate. You're gonna take whatever solution they give you. All right? So out of desperation, I made the same mistake. But like, I still take some herbal stuff when I get the panic attack and I can't sleep. I take passion flower, and I take sometimes chamomile tea. They seem to help a little bit, but if you take them every day, they don't help at all. If you take them during the time of the panic attack, they might help a little bit. I don't try to take them every day. Once in a while, because that's how medications work. When you take them every day, your body develops dependence on these herbal medications. It starts to rely on them, right? So you cannot sleep because you're not taking the herbal medications, and you have to keep increasing the dose. They work like a drug, pretty much, just like any other drug. If you take heroin, the first small amount you take the first time it may be so powerful, right? But your body get used to it, and then that small amount you take, it doesn't affect your body anymore, so you have to increase the dose. Every drug is addictive. I don't believe they say, well, no, you can develop addiction to this drug or that drug. They lie. It's a lie. There is no drug that is not addictive. Maybe they are less addictive than other drugs, but they have a percentage of addiction, every drug, because it's not meant to be in your body, right? Therefore, if you put it in your body and your body starts to depend on it, it's an addiction, right? Anything that your body starts to depend on becomes an addiction, right? It's like a cane, you need a cane to walk. The same thing, you're using that like a cane, right? You develop a dependency. Once you develop a dependency on any drug, it becomes addiction, right? It doesn't matter if they say the drug is not addictive. It doesn't matter what the doctors say. I don't believe in that. I just believe every drug that your body depends on, whether it's a herb or pharmaceutical, it's going to cause problems. As soon as you develop dependency on it, it's going to cause problems. That's why I don't take them every day. They are called drugs for a reason. You're only supposed to take them when you need them, not every single day, right? Even caffeine. coffee is a drug. People will argue with you, no, it's not a drug. It's okay to take it every day, and it's okay to drink it every morning, and it's healthy for you and whatnot. No, it's not. I don't believe it's healthy for you. Some doctors, they will argue, they say it's healthy. It's not. Because it's a drug. Your body is dependent on it. It's addictive, and you try to stop the caffeine, you're gonna have withdrawal symptoms. However, I'm not against drinking caffeine once in a while, right? Once in a while, let's say haven't slept for so long and I need to drive, then I might crash, right? If I don't make myself awake, right? So it has some uses, just like any other drug. Like, you have fever, you take Tylenol. You don't take Tylenol every day, right? It's like that. You use it when you need it, right? You're not supposed to use it every single day. Everything you take every single day, whether it's a herb or a pharmaceutical, is going to harm your body. It's for sure it's going to harm your body. Even the ones that says it's healthy, even the healthy herbs that are supposed to be beneficial to your body will for sure cause harm, will for sure. Like, for example, lecithin supplements. Lecithin is also an emulsifier used in chocolates, and other food products. They use them as emulsifier or thickener or stabilizing agents. And just yesterday I was reading something about it. They were saying we should not use lecithin as a emulsifier because it causes health problem when you take it for too long, right? So they're trying to find an alternative to it, like gum arabic, right? So lecithin was advertised, when I was buying the lecithin supplement before, it's advertised as it's good for your heart health and it's good for your liver, right? So that's why I was taking lecithin supplement, right? But after reading this article that it could cause heart problems, it could cause some people having heart attack from taking lecithin supplements, cardiac arrest, and just realizing, like, it's advertised as good for your heart, but it actually can be bad for your heart if you take it for too long, right? Just like with any supplement, it might be advertised good for your liver. You take it for too long, it might damage your liver, right? So you have to be careful when you take supplements. I'm not against supplements or pharmaceutical. Sometimes they can help you get out of certain situations, but you have to be careful when to use them. You have to weigh the benefit over the risk and make your decisions based on that. If the risk is greater than the benefit, then you don't take them. Like psychiatric medications, the risk is way higher than the benefits. I mean, just read the side effects: death, liver problem, heart problem, all these things. The risk doesn't outweigh the benefits. It doesn't. So that's why you shouldn't take them. I know in certain situations it might work good for some people, like psychiatric medications might help some people without the panic attack. Like for me, it was not helping me. It was causing problems. That's why I wouldn't take them. Maybe some people, they'll say, well, their life improved, and I hear both sides. They say after taking psychiatric medications, their life got better and now they're normal. So for these people who take it short term, they're only meant to be used short term anyways. They don't take them long term. Like psychiatric medications, if you ever decide to take them, make sure they're not going to cause you panic attack or any health problem. And if they do, stop. Don't take them. If you take them, use them short term. That's it. They don't work for you short term, fuck them. Don't stay on them forever. That's what I'm trying to tell you. If you stay on them for too long, the the harm is greater than the benefit, and uh, you're harming yourself. If they work, they should work short term, and if they not working short term, that means they don't work at all. Don't risk it. Okay, don't risk it, because your body will be dependent on them. You're developing addiction, and they're causing health problems. You don't want that. One more thing I want to talk about is that I remember an advisor told me, like, a sleep when I was dealing with my sleep problem, I went to sleep therapist to help me, and she advised me that if I have panic attack while I'm in the bed, I should leave the bed and go to another room. And I learned that this actually doesn't work. Her advice doesn't work for me. Because when I'm having panic attack, sometimes I do better if I stay in bed. Now, I know her reasoning why I should leave the bed is because I don't want to associate bed with panic attack and anxiety. I understand that logic. But sometimes things that seem logical, they don't really work, right? You have to work outside the box, right? They don't work. You have to use what works, right? For me, what worked was to stay in the bed, actually. Do some breathing exercises in the bed. Sometimes they work, sometimes they don't. Do breathing exercises. And I could fall asleep sometimes right after the panic attack. Yeah, right after the panic attack. Because, like, in my head, I just be like, okay, I know the sleep is causing the panic attack because I can't sleep. It's okay. I keep assuring myself, like, no, nothing's gonna happen to me if I don't sleep. It's fine. I keep breathing in and out, and I keep reassuring myself, like, it's okay. Even I don't sleep 1 day, 2 days, I don't sleep, it's fine, right? So I have to keep reassuring myself, like, nothing, there's no danger, right? And just breathe in, breathe out. It's like, I don't care if I don't sleep, I don't care if I die. In my mind, I just keep reminding myself like this, and sometimes it works, right? It works, and I fall back asleep. It takes time to fall asleep, but I fall asleep. Like last night, I was having panic attack, so I kept doing the breathing exercises and reminding myself that it's okay, even if I die, it's fine. And like, slowly, eventually, I was able to calm down and relax. And then when you're in bed, I think it's better to try not to move too much, because moving could raise your heart rate, and that could, you remember, when you have panic attacks, your body is oversensitive, right? When you have anxiety or panic attacks, your body is oversensitive. So you want to cut down anything that will raise your heart rate, right? Whether it's working out or moving too much in bed, thinking too much, right? All these things could raise your heart rate. So try to lower your heart rate, and eventually you're gonna get over it. The idea here is you want to teach your body that it's okay to have panic attack. It's okay, because once your body learns it's okay to have panic attack in the bed, the next time you have it, it's not gonna be as hard, right? You'll be like, yeah, I dealt with this before, I could deal with it again. I know it's coming. I know, like, psychologically, that's how it is, right? That's how you process it. Your brain, you're thinking about it like this: I've had it before, it's not a big deal, it comes and goes, and I'm gonna be okay. So the more you have panic attack you have in your bed, the more likely you're gonna be able to handle them when they happen again. in the bed, right? So slowly your body gonna get used to it. Eventually you get used to having panic attack in the bed, and then it's gonna be okay. It will slow down eventually, and then you're no longer gonna have panic attacks. However, when I leave the room while having panic attack, what I'm doing, I'm moving, right? As soon as you get up from the bed, your heart rate shoots back up, right? And the panic attack become even more worse, right? So that was the wrong advice, because as soon as you get up from the bed, it's normal for your heart rate to go up when you get up, right? Now your heart is even racing more faster, and that creates a positive feedback loop, a positive feedback to your brain that I'm in danger. I'm even more, like, you know what I mean? Because you're reinforcing to the brain that there's something wrong, right, when the heart rate goes up. And so the idea is, no, you don't want to do that. You don't want to get up. You want to lay down, breathing exercises, try to relax. And even if you have to get up slowly. Like some days I had to get up to make like a chamomile tea, just to see if I could calm down, or take a shower to calm down. Even then, I try to do it slowly, right? Slowly, not rush, not like, you have to be very calm when dealing with panic attack. That's what I'm trying to say here. I hope this helps some people out there that are dealing with panic issues, because sometimes we cannot get the help from the doctors or the specialists or the advisors. They give you the wrong advice sometimes, because what works for someone may not work for another person. So that's why I'm sharing this.